Hello viewer, welcome to today's episode of Talk Show. Today we have beautiful guests in the house and I am your host Lucy Wanza-Kariuki. Our SMS line is 21144 and our social media platforms are GBS TV Africa, both on Facebook and YouTube channel. We are today discussing about pain. This is the month of September, whereby we are sensitizing about pain. And we understand many people have had some point or some kind of pain. But what is it that we call pain? What are the causes? These are some of the things we'll be looking through. So to our dear guests, kindly tune to us, don't go away, and we are going to be with you throughout the show. To our guests, kindly introduce yourselves and tell the viewer where you come from, where you work. I start with the lady. Welcome to the show.
Thank you. I am Eunice Mino, a nurse by profession and passion, working in Kangundo Sub-County Hospital, currently placed in the Department of COVID Center, whereby our patients, as the topic of today suggests, also undergo a degree of pain. And I am delighted to be here with you as we go through this topic together. Thank you.
Thank you so much, Eunice. That introduces us to some special kind of pain, because I'm sure these patients will not have physical pain. You will be talking to us. Thank you so much. Daktari, karibu.
Thank you. Hello viewers. My name is Dr. John Murebi. I'm a consultant doctor of physical therapy. I work at Babaret Consultancy at Parkrans. I'm happy today to be here to talk about pain. And to our viewers, I would want to give them a theme of the day. Let us tell them that pain is not a lifestyle.
Sure.
Thank you.
Thank you so much, Daktari. And now that you have told us that pain is not a lifestyle, and we are here to educate and to empower our people, kindly introduce to us to the topic of the day.
Thank you, Lucy. To start with, and to tell our viewers that the pain is all controlled by the nervous system. And you know, they used to say, it is the horn of the shoe where who knows where the gonna pinches. And that's now the pain.
Yes.
Pain can be described in very many ways. Pain can be itching, pain can be aching, pain can be dull, pain can be anywhere at any part of the body. And it is contributed by million and a million of factors.
Yes.
A structure can cause a pain, psychosocial, mental illness can cause pain. And all this, we put it in one umbrella and we call it pain. Yes.
Is pain visible?
No, pain is not visible. And for your information, pain is not directly proportional to the rate of damage. Yes. Pain can be categorized into either irritability, severity, and all this. You can be having a lot of pain, but the rate of damage is very minimal, is insignificant. Yes.
Okay. Thank you so much, Daktari, for that introduction. Eunice, kindly tell us, can we be able to classify pain? Are there types of pain or classifications of pain?
Yes, we can classify pain from acute pain. This is the kind of pain that has a sudden onset. And you just well this minute, and the next minute you're having a headache. You're having a stabbing like feeling. We can also have chronic pain. This is a pain that is caused by a prolonged period of disease or illness. For example, when we talk about cancer patients, this is a situation whereby the disease process takes too long. So that pain is clustered under the chronic pain. We also have the neuropathic pain, whereby the nerves, as Daktari has said, pain is all about the nerves. So as the nerves are affected, or the nerve system is affected, it projects pain. There's also the noroceptive, whereby there's a disease or this injury to the tissues, the body tissues, that causes pain as well. Then we have the radical pain, class of pain, whereby the spinal nerve is compressed, it's pressed,
Yes.
and as a result, it brings pain to the legs. You feel that your legs are numb. You feel your legs are tingling. For instance, when you go to the toilet and you sit on the basin in an improper manner, there's that feeling when you press on the sciatic nerve. There's that
Yes.
feeling that you feel like your something is running inside your legs, and then you feel like they are numbing. You're not feeling them anymore. The moment you stand, that pressure is released. You go back to your normal self.
Okay.
Yes.
Thank you so much for that description. You know, I was just thinking about something which is very common. And I would like you or Daktari to answer the viewer. Sometimes you see these people with tooth. That person starts having pain on the tooth. And there is no injury. How can you describe that kind of pain, Daktari?
Thank you. Before I answer that question, Lucy,
Yes, yes.
I want to hand more weight on what my colleague has said. In terms of acute pain, this is a pain that lasts between day 1 to at least 3 months of time. Chronic pain,
Acute.
yes, acute. Chronic pain is the pain which surpass more than 6 months plus, and we call it chronic pain. This one can be either pain like that of arthritis, pain of the hither muscle, which has got swollen for many months, acute pain, and a nociceptive pain that she has talked about. You can get a trigger, like either you can get a bro on your elbow joint, you can get a bro on your ankle joint, and you get such pain. And she has also talked about the radicular pain, the pain which is either due to the spinal processes of the backbones. Here, this pain comes as a result of either, let's say, an interruption of a nerve, or either disc or a facet, which will give now pain down. You know, pain is broad, and if we try to describe it out, like the one that Eunice has told us right now, we can give it more of, like we can say it's a radicular pain, but more of a radiculopathy pain, whereby nerves are being involved. Now, on the issue of the toothache, you know, the brain itself has got nerves. We call them carrier nerves.
Yes.
There are 12 of them. Like the nerve which originates, or the nerve which gives impulse or power to the temporomandibular joint, it's the trigeminal nerve, carrier nerve number 5. A sense of a nerve, when a nerve gets out, it can get out into 3 portions. The vertebral, the vertebral part of it, the spine part of it, and the mid part of it. A nerve which tell you today, oh, today is cold. Let me keep myself warm. Today is hot, let me remove sweater. It is the same science which will teach you today, like say, for example, when you feel that sound, that pinch, that pain get produced. But remember, there's this say that says that no gain without what does it say? No pain without gain. When a tooth give a signal, the impulse, the communication between a nerve, it sends impulse to the spinal cord, and then the brain interprets. For example, if today I have pain on my ankle joint, the pain is not there. The pain is in the brain. But now, what we try to give this patient, like say a painkiller, it comes and block the pathway, the mechanoreceptors. But let me not use the big ones, because those ones will be jargons, and you already warned me that.
Yes.
It will come and block that pathway, so that the brain cannot interpret like what? Pain. So the sound that people feel or hear, so that it can produce pain as a result of toothache, is as a result of the brain, the nerve communication. That's what I can see.
Okay.
Yes.
Is it the same thing as, for example, I want to take a mother
Yes.
who delivered and had For example, cesarean section.
Yes.
And today she sees the child fall down and immediately she starts having pain on the incision site. And categorically thinking it's a joke, this person will come to the hospital with a lot of pain. And if you ask what really happened, any injury? No. What happened? I saw my child fall. How can you translate that
You know
to
what,
the viewer?
You know what, Lucy?
Yes.
And what I can tell our viewers is, when we were giving definition of a pain, we say it's all about the nervous system. Okay? It's all about psychosocial.
Yes.
I will answer that question by just a story. A simple story of just 2
Yes.
seconds. There's this guy who was trying to build the 7-tall building, and at a point, he got an accident and he fell down. Down there, he had a big, the boot, the gum boot. So he saw a very big nail protruding from down on his big toe up. And this gentleman started crying, shouting a lot of pain. I have a lot of pain. And the gentleman was rushed to the hospital. You know what happened? The doctor trying to cut the shoe. He tried to penetrate to check where the nail is. And you know, the nail was in between the big toe and the second and the second finger. So where was this pain coming from? So pain is all about psychosocial.
So in short,
Yes.
the guy had not been injured,
No,
but
no
he was
brand,
crying
nothing.
of pain.
And the guy was crying of
So the
pain.
same way to
Yes.
this mother
Yes.
who
Yes.
cries of pain comes to the hospital
Yes.
simply because she has seen something.
Yes. In other words,
Yes.
the pain is always directed by the nervous system. How naive are you towards a certain
Pain.
receptor,
Receptor.
towards a certain stimuli?
It's so wonderful. You've talked of pain that is lasting for less than 3 months. That is acute pain.
Acute pain.
You've talked of 3 months and above. That is chronic pain.
Yes.
Let me ask you one question, Doctor.
Yes.
Somebody who has had pain for like 5 months, 10 months, like now, somebody who started having pain from January up to this day, are they still perceiving the pain as pain, or is just imagination? Is there real pain?
There's real pain and there's imagination pain. Like a patient who has pain for the last 5 months, those are kind of the patient that you get in the clinic and they tell you, you know what, treat this pain of mine. They call it pain of mine. They have already even accepted it and they own it. Yes, and it's one of the myths that people have outside there. Yes, the perception that it is that pain of mine. Yes.
So with chronic pain, in real sense, there could be no pain.
No, there couldn't be pain. Let me give an example. A patient who has arthritis. Let's say I own the mom of 60 years old has been experiencing pain at the knee joint. And you know, the arthritis, and the definition of one arthritis is tear and the wear of articular cartilages. So this patient wouldn't be getting those cracking pop sound, that irritation, that tear and the wear, that irritation. So pain is there, but this patient has been used to it. So every day, there's no day. For the last 5 months, for example, she has never experienced less pain. So it will be there. It will be there.
Oh my
Yes.
goodness. I wonder if that is real pain. Eunice, you are a nurse.
Yes.
And a proud one. You've told us that you're currently working in isolation unit. But before we come to COVID-19, let me go back. Because I'm sure being a nurse, there was a time you worked in a medical or a surgical ward. And we've had people there who have been in the ward for more than 3 months. If not many, 2 or 3. If these people continue calling for help because of pain, kindly tell us, what have you been doing? Because from what Dr. is saying, I am worried of the analgesics or the pain drugs that we have in the market.
Yes.
Yes.
Medicine bars us from defining pain for a client, because basically pain is what the client tells you they're feeling. So we will not quantify the magnitude of this pain But as daktari is stating, there's a perception that because I am in the hospital or I have stressors within me, then I am in pain and this is it. So having worked in a surgical, in a medical, in maternity, and even in the newborn unit,
Yes.
I would say those clients are there that are in pain, pain that you can perceive, pain that you can feel, that empathical pain. You can see this patient is truly suffering. I'm not trying to say that there are those that are not suffering, but what we usually practice is we will check on the pattern of your presentations, and because we are empowered, we are equipped with knowledge on pain management, then at that particular moment, that is the time we're going to see if this patient will need a pharmacological therapy,
Yes.
or it will be a pharmacological therapy. So that is basically what transpires.
So in short, you people, from the evidence that the patient is complaining of pain,
Yes.
yours is to do your duty, to administer the drug.
Either the
And
drug,
also to,
you can also give other options
Yes.
that are non-pharmacological exercise.
like,
You can
exercise.
tell them to do deep breathing. You can tell them, you can guide them into meditation. You can also try to distract them. Like I give you a book. I ask, what's your hobby? If I know this is what you like, maybe you like watching soaps. This television, you call them what? These television soaps.
Soaps, yeah.
I get you to have one. Then your mindset is distracted from your pain. Now you're concentrating on this, and through that you're able to manage your pain. You forget about that pain.
Okay.
Yes.
Yes.
And also to add on what doctor is telling us,
Yes.
when a patient comes in the clinic, like me, being a doctor of musculoskeletal, we have skills. We have a special test that we want to ascertain truly whether this is the real pain or it's just that pain which is psychosocial. We have some tool that I can tell our viewers today. We have a skill like VAS scale, the virtual analog scale, whereby you give a patient a scale of 0 to 10. And then you tell the patient, in a scale of 0 to 10, where 0 there's no pain at all, 10 there's a lot of pain, which even can make you go to ICU unit. Where can you rate your pain? Okay? So the patient will tell you, no, in a scale of 0 to 10, I will raise my pain at 6 out of 10. So now you ask this patient, now what's your goal? Or what do you want with this pain? The patient will tell you, I want my pain to ease. So when I'm trying to give them now the treatment, as the doctor is trying to tell us, either we give medication, we give exercise and everything, so we will be fighting to see whether after the end of the session or at the end of the treatment, has the pain gone to 0 or not? There's other skills where we give a skill like PFSS, where that's the now patient functional scale. The patient now try to tell you, oh, yeah, when I move, that's when I feel pain. When I sit down, that's when I feel pain. So I have a way of also grading the patient. And by doing this, I will be knowing really this patient is suffering, yes, that's real true pain, or it's just a psychosocial pain. And then now I would say, and this is a patient who needs counseling. No, this is a red flag. This is a patient who has maybe cancer, because a cancer patient with, let's say, a tumor, the pain will not be constant. It will not be intermittent pain. It will not be a on and off pain. No, I'll take this patient to an oncologist. No, if the pain is intermittent, it's a on and off pain, I'll take this patient to either an orthopedic doctor, an orthopedic surgeon. So that's how we grade the pain.
Thank you so much, Daktari, for that response. And you leave me with so many questions. Like, if we have a scale of 0 to 10, which means like 100%, we may not be able to define the kind of pain that the patient is going through, depending on personality, depending on emotional status of the person. And this is where we have also seen funny things happen. For example, when we come to children, because they're also people, they're human beings, they're our patients day to day. You realize a child who was hurt in the morning in school will cry at home at 4 p.m. and the incident happened at maybe 10 o'clock in the morning. Again, you realize that when we are dealing with the youths, because they're also our clients, a youth may be hurt on one leg. Then, all of a sudden, you see him jumping with one leg, expecting the non-injured leg to be the one touching the ground. You see the one which has been injured is the one touching the ground. Mm-hmm. So you're left wondering, what is really pain? Can it be faked? And therefore, this one leads up to the next question, which goes to Eunice. Mm-hmm. What are some of the myths and misconceptions about pain?
We have so many surrounding pain. And Dr. had mentioned several. There's this slogan to every person that goes to the gym and the muscle builders. Mm-hmm. No pain, no gain. What
no
are you
pain,
being told?
No gain.
Yes, no pain, no gain. Mm. What are you being told? Mm-hmm. You have to work those muscles till that pain gets used to you. Mm-hmm. Which is not proper. Mm-hmm. Every muscle or every tissue needs time to heal. It needs time to recover. Mm-hmm. And extraneous exercises can also lead to tissue damage. Mm. You can sprain, you can have a tear of those tendons or tissues. So that is a myth that needs to be corrected. Mm-hmm. Amongst
no pain,
many
no gain.
Of us that want to stay fit. Mm-hmm. We can modify our exercising and diet.
And also acrobats. We see them doing very good work.
Yes.
And after that, you see them behind the scene crying of pain.
Exactly.
Yes.
And these are the people that are constantly on pain medications. Mm-hmm. So that as they try to make it known to the society that no pain, no gain, you hurt yourself, and as a result of that hurt, because it is no pain, no gain, and I want to gain, what you will resort to?
Pain
medication. Mm-hmm. Yes.
Okay.
We also have the slogan of, as Daktari put it, you own the pain. My headache. Mm-hmm. My teeth ache, my toothache. Mm-hmm. You have my, this is the season, or this is the days of the month that I usually have abdominal pain. Mm-hmm. And after 2-3 days, it will be gone. Mm-hmm. That is a myth. We should not own any kind of pain, because as Daktari said, there is a possibility that this pain, a pain is it's sending message that something is wrong. Mm-hmm. So if I own an headache, mm-hmm. like this one, I have it all through, and maybe I'm developing a tumor. Mm-hmm. in my brain or in my head, or I'm developing another problem. Mm-hmm. I might be, my blood pressures might be too high, uncontrolled, because they're not diagnosed, mm-hmm. and as a result they are causing me to have an headache. Yes. As a symptom of this problem that I'm having. So if I own this pain, I am ignoring the messages that are being sent. Yes. And as a result, you will have an eruption of complications from that owning of the pain. Again,
Eunice, thank you so much. At least you're taking us somewhere. And before you continue, because I understand you have several myths, which I'm sure Daktari will also back you up. Yes. Viewer, this is Health Talk Show, and we are doing pain awareness during this month. And we are sure that so many patients, so many people have pains, and they really would like to hear. Stay tuned. We are in GBS TV Africa. Our Facebook or social media platforms are GBS TV Africa. Stay tuned. We are continuing after the break. Everywhere GBS. Welcome back, viewer. Our discussion is still on pain awareness, and we are just discussing about some of the myths and misconceptions about pain. No pain, no gain. Let us not buy that idea that we have to endure pain for us to gain something. Eunice, you are telling us something. Kindly go on.
We were talking about owning
Yes.
pain. This is a dangerous practice because it will predispose us to complications of illnesses and diseases that send signal early enough. But because in our brains we've taught ourselves this is my disease, this is my feeling, this is my pain, we conceal it and things blow out of proportion. For instance, we have the elderly, those that are lucky in our homes. And once we go visiting them and ask, Grandma, how are you feeling? I am okay. It is only that my headache is still there. Remember, as this person is having tissue degeneration, there are complications, there are issues that raise from such. This person might be having diseases that are erupting due to the degeneration of cells and nerves and tissues, and they are developing arthritis. They are developing hypertension. They are developing diabetes mellitus. But because they are owning this my pain, that leads to you go too far to manage that owning of that pain. And again, there's another misconception whereby we all know if I am in pain, I have to get a painkiller. Not all pains deserve to get a tablet.
Yes.
Not all pain deserve you actually going to the hospital. Why? I am stressed because maybe I failed my exams and that thing is giving me a heartache. That translates to emotional instability. And due to that emotional instability, I want to think hard, I want to feel bad, and as a result, I am having this particular headache because I'm not allowing myself, number one, to relax.
Yes.
I am not allowing myself to sleep adequately. I am not allowing myself to, actually, I'm not even easing that feeling. So when it builds in me, I get a side effect of an headache.
Yes.
And because it is this headache that I'm feeling, I am running to go and take a painkiller. Yet I know it is because I failed my exam. I am associating my headache to the failure of exam. So it is not all pains that are treated by use of medicine, by use of analgesics, by use of painkillers.
Yes.
We can employ other mechanisms of relieving pain. Like as I said earlier, you can practice deep breathing, and actually this works magic. You just hold your breath, you breathe in deep, you hold it for a while, and then you relax, and you repeat this for several minutes. This helps your brain to oxygenate. It helps your brain relax, and as a result, actually the pain that you are feeling, you feel it's relieving, it's easing. You can also do exercise in moderation. You can go and, if you like jumping, you go and jump. You can go for swimming. You can go to you distract yourself from this through exercise, and actually it helps you. For example, I have slept in a bad position. And when I'm waking up, my neck is so much hurting. Does that really warrant me to go and take a painkiller, a Panadol, a Maramoja? You know, us Kenyans, we like Maramoja because the name is associated with Maramoja. So you think when I take this Maramoja, the pain is gone. So what do you advise such a client when they come to you? Like, when I sleep, I wake up, my neck is... You just talk about positioning yourself. There's a position as well as you're seated. You can sit and then you hurt your back muscles. When you're waking up from here, you're feeling pain on your back. Does that really warrant you to to take medication. So
Yes.
those are that is part of the myths that are associated with pain, and it is unfortunate because we cause more damage from the myths and misconception.
Yes.
And it is expensive to manage a complication
Sure, sure.
of something that is very simple. Like you've had a myth that you've hold on to so dear, then that myth brings about complications.
Yes.
For example, when I sit badly, hurt my back muscles. When I sleep in a bad posture, have neck pains, I go for medications. Then tomorrow, nobody tells me that sleep in this position. Do not use overpuffed pillows. As you sit, don't sit leaning forward. Sit in an upright position. Do not jump in this posture. Jump in in a proper way. I will keep on taking medications. We all know that medication, pain, especially analgesics, the pain medication, they have long-term effect to our body systems. For example, they can cause the kidney stones, and that is a problem to you, because now that kidney stone that has been caused because of prolonged use of analgesic will lead to now pain.
Yes.
Pain that was not to be there, but because of that misconception, because of that myth, it led you to taking medications that has led to you to having now this complication.
Thank you so much, Eunice. Myths are things that are there. They are not real.
Yeah.
They have no basis. I remember there is this one myth which almost killed me. All through my secondary school period, I remember I used to have a lot of cramps during my periods. And because when I told my mom, she used to say, I used to have the same. This is why you have it. Don't mind, it will come to an end. As long as you are my daughter, you have to face it like I used to. I thought it was true until I joined the medical school. And I was told, no, this is not a lifestyle. Just take painkillers, and everything changed from that time. So myths are things that are there. We cannot cling on them. You've also raised a very good point that it is expensive to treat a complication. Daktari, what are these complications of pain?
Okay, thank you. That's a good question. But before I even talk about these complications,
Yes.
you know, we may not mention the number of the drugs because also to avoid other complications of the court and everything, because they may be saying that it's like we are telling our viewers not to take a certain drug, the one that they have been used to and advertising it. But in this myth that Doctor has just mentioned a few, and dysmenorrhea pain, pain as a result of periods, pain as a result of old age, pain as a result of backache. Lucy, I want you to imagine, this is a lady who was conceived. She has given birth to 2 kids. And then when she's just giving stories to other women, they say, oh, you know what? My back hurts. And the other women tell the lady that, you know, we are all women. There's the nature of any woman. Okay? That's the nature of any woman. As long as you are a woman, you have to get back. So that's another myth.
Yes.
Okay? And dysmenorrhea pain, then this is pain as a result of periods. Today in the morning, I was treating one lady, early in the morning. She told me, you know what? I started seeing my periods yesterday night. And what I want, before you treat me, let me first take Panadol. So that I can prevent that pain from coming. I don't want to feel it, because every time I know I'm getting my periods, I have to take a certain what? Painkiller. And you know what I told her? Suppose you could get a natural way of preventing this pain other than taking these drugs all the time, because there are side effects of any drug. Any drug has a side effect whatsoever. Either you take it overdose or underdose, it will give you a certain what effect. So now, there are very many complications when you get this pain. For example, if today you go and get your baby through CS, that is now the cesarean sections. What happens when you bend down to pick something as a mother? The muscles at the back, they lengthen. The muscles at the stomach side, that is the abdominis, all those big names of the muscles, they shorten. Now, when you get a CS, the muscles at the stomach side, they don't shorten when the back muscles lengthen. So what will happen? They are very good friends to each other. They will compensate to help the muscle which is not doing what? Working. So if you don't go and seek a medical attention, you will get a lot of muscle spasms, you will get a lot of complications of your back, and that's one of the complications because back in your mind, this back pain is because I've given birth. So you don't want to go and get what? That treatment. Okay. There's another complication as a result of this myth that Dr. was mentioning here. I want Mama at the very end. She has told us that when you go and visit that grandma, tell you, I have this ending, but I think it's because of my old age. Okay. Remember when we were starting this show, I told our viewers this. Pain is not a lifestyle. You are not born, Lucy, today to live in pain. Instead, you are born to live in peace and happiness. Okay? And that's why even those who goes to church, they will give you those quotes of the Bible, whereby Jesus came to give us life in its fullness. Also, in your day-to-day activities, in your ideals, me as a doctor, today, I went to school to return back something called functional mobility. Functional. What are you not able to do with this pain? It's me to return that functional mobility, functional movement. What is this pain preventing you not from doing? There are very many of them that we cannot mention here. We can mention them, but we can stay here for more than 3 days giving all these complications.
Yes.
So for this one, Mama, we need to know, is it articular cartilages? Is it a structure which is bringing this pain, which is bringing this headache? Can we sort it out? Can we give it a certain treatment? Rather than me saying, this is old age. After all, she's 83 years. She has gotten very many wajugus and ichukus. No, we should not do that. We need to see how can we help this patient. Another way, Lucy, another complication that comes as a result of this myth, there's something called ADLs, activities of daily living. I'm a soccer, I'm a footballer, I'm a rugby player. Okay? When I get an injury, I just say, after all, what I'm going to do, I'm going to massage this part, and then I'm going to look for TPT, I apply it there. That's the normal protocol of doing things. You know what? And this is what I want our viewers to know today. It is not all tissues which have pain. They are subject to massage. They are subject to deep heat. There are those which need just a rest. Okay? There are those which just need just an ice, acrotherapy, and the pain is.
Yes.
But if you go and start trying to put more tension on that muscle, more tension, that patient might develop a deformity.
Okay.
So all these are complications of this maze. Yeah, we continue.
Yeah. Thank you so much, Daktari.
Lucy,
That's
maybe
very
I can
enlightening.
add on what Daktari is saying by giving a small illustration of a situation that happened to me. I once broke my right foot around the ankle area, and unfortunately I was in a marketplace, and outside the society we have so many perceived doctors, we have so many perceived
Community doctors.
Yes, community doctors. Thank you for that name.
Yes.
And once I fell, I was just walking, then I stepped on a smooth stone that resorted to my sandals sliding, and when I fell, I would tell that is not just an injury, but it's a fracture. I would tell because I would feel the pain deep inside the bone, and it was very characteristic. So when I was collected from the ground and sat on a bench, I tried to lift the leg, but I would feel it's kind of numb. When I had a brief look at the lower area, it was swollen, very swollen. So there's this lady that told me, you should not even let this leg continue swelling. The joint has come out. You see the way the community expresses it. The joint has come out, so let me return it. Now she's telling another lady, pull the upper leg as I pull the foot, so that we return the joint in place. And then my mind clicked. It is good. If it is the joint, it will return early, so the pain will be less. But what if it's a fracture, and the fracture is not complete? Then these people will help the fracture to be complete. And we all know the complications of such. So I was too fast to tell them, hold on, kindly, do not even massage the foot, do not do anything, just give me a kaluma. We apply lightly, gently, so that they don't feel I am too much over myself. I don't want to be helped. And remember, these are the same people that will get you a car that will take you to the hospital, because now you're there and you hurt. So the lady gave me a kaluma, and I told her I was in pain, that I wouldn't even feel my fingers. So I told her, no, let me apply the kaluma myself, for them to have that satisfaction of they have done something. So I took the kaluma and applied around my ankle area lightly. And when I got to the hospital, after I got the first shot of painkiller, we went for the x-ray. And I had my joint, there was a joint aversion. The joint was out and it had slided lower. Then I had a fracture that was not complete. So I told myself, so if this lady really did that massage she wanted to do and the pull and fix thing, then what would have happened? A complication.
Complication.
Because you did the improper thing at the wrong time.
Yes.
And again, when it comes to pain, this pain that you're experiencing, if it goes unmanaged, it will cause depression to you. Because you're in pain and you're not stable.
Sure.
This depression will cause you not to sleep well. So as a result of not sleeping well, you'll not be able to perform.
Yeah.
So in school, you will not perform. At work, you will not be able to perform. And remember, if you don't perform, your boss will not have any business with you, because everyone wants a performing employee.
Sure, because you are not useful at that particular
You are not
point.
useful at that particular moment.
And your point now leads us to our next discussion about what, briefly, Daktari, for the sake of time as we wrap up the show, kindly take us through the first aid and general management in 3 minutes of pain.
That's also a good question that those our viewers are supposed to know. There are very many ways of managing pain, either at home, in the clinic, wherever you are. But as we said, pain is not a lifestyle. There are pain that they can get first aid. Yes. By anybody around you, and there's other pain that they need a consultant, and there are pain that they need to be taken care. I want to take our viewers through a very simple thing. I would want them to know first thing that they need to do when they get pain. One, let's do something called observe. May they observe. Okay? By observing, they will know, is it swollen? Is it bruised? Is it reddish? By doing this, one will do an induction that, no, this one is a serious case. Please don't rush to do that first aid. Okay? Then, let's also know something called rest. Rest is very very, very important in any pain. Icing. Icing is the best way out. When you have a fringe, when you have that something called, either it's a result of either, let's say, a fall, you need to do that icing. Then from there now, let's also think of something called compression. If it is swollen, can we first compress before we do anything? Because it's not all tissues today, Rosie. They are subject to manipulations, application of those drugs, those narcotic drugs, those painkillers and everything. Okay? Then, after that now, let us compare. Is there any results? If no results, do we need a medical attention? That is the simplest way I can tell our viewers today. Don't rush to buying a painkiller without a doctor's prescription. Don't rush to that mganga at home. Telling, give me this sweet what and what, I apply here. Okay? Don't rush to that sweet, let me take something, sweet counter, I apply here. And for your information, and this I want our viewers to know today, there's pain that we have not mentioned today called referral pain. A referral pain can be either somatic or a visceral. The two jargon means somatic is any pain which is being defined by either a structure which is outside. Visceral is any pain which is being defined by something which is inside the stomach. For example, today, Lucy, you can be having pain as a result of hemorrhoids. You can be having pain as a result of uterus. And this pain will not be, you will not be having this pain at the uterus. It will be going back at your back, front back. You can be having pain on your left shoulder, and then you start applying karuma there as your first aid. But for information, it's a problem with your heart. When it goes on the other side of the right side, it is the lungs. Do you know why? Because when the nerve exceeds the foramen, when they exit outside there, an artery and a vein, where a nerve is, it is formed by an artery, it's formed by a vein. And this vein and the arteries, they all go directing what they are supplying to a certain organ. So the one which might be goes to the shoulder, for example, is one which goes to the heart. So if the heart has a problem, it will refer pain to the left what? Shoulder. Then now,
so what you're trying to say, Daktari,
Yes.
is, for example, now when you're managing pain,
Yes.
you have to observe.
Yes.
You do not have to rush to the hospital.
Yes.
You need to be very keen.
Yes.
Which means now, Eunice, as you wrap up the show and give us your parting shot, pain, when we talk of pain and painkillers, or well, let's call them analgesics, they can be abused, yes or no?
Yes.
Yes.
They can be abused.
They can be abused.
Because this pain, if it is chronic, the body will get used and you can't do
Yes.
without it.
Yes.
Kindly give the viewer your parting shot and finish.
Okay.
Yes.
I will emphasize on what Dr. Ria said. Let us learn to observe our pain. Let us learn to first see how things will be, but do not take too long in the observing period, because again now this can bring a complication of the situation at ground. Please let us not be too quick to take that painkiller, because as we have said, every drug has a side effect. And again, the prolonged use of these painkillers can lead to complications in our bodies. They will affect our kidneys. They will affect our liver, and these are they are part of the key body organs that normalize our function. So once you feel you're in pain, observe.
Thank you so much, Eunice.
Thank you.
And yes, Daktari, your parting shot?
My parting shot to our viewers is to tell them that let them observe pain, and again, pain is not a lifestyle.
Thank you so much, viewer. We were doing sensitization or awareness of pain in this month, and I am sure you have learned something. Pain should not be a lifestyle. Pain should not be part of you. If you have pain, seek medical attention. Thank you so much for our guests. It was a pleasure having you in the show. I was your host, Lucy Wansa Kariuki. Bye-bye.